This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about respiratory hygiene and cough etiquette. From this session, you will have an understanding of respiratory hygiene and cough etiquette techniques to prevent the transmission of infection. Standard precautions refer to work practices that are applied to everyone, regardless of their perceived or confirmed infectious status, and are the minimum level of infection prevention and control. Respiratory hygiene and cough etiquette are elements of standard precautions and describe the techniques implemented to reduce the spread of respiratory pathogens. There are a number of organisms that are transmitted through respiratory droplets. These droplets are large particles greater than 5 microns in size and are generated by a person coughing, sneezing, or talking. Droplets do not remain suspended in the air and generally only travel short distances. Within 1 metre, the particles will have fallen to the floor or other surface. Respiratory hygiene and cough etiquette involves covering your nose and mouth with disposable single-use tissues when coughing, sneezing, wiping, and blowing your nose. Use the tissues to contain the respiratory secretions and then dispose of the tissue directly into the nearest bin. If you do not have a tissue available, cough or sneeze into your inner elbow or arm rather than the palms of your hands. Handkerchiefs are not recommended in respiratory hygiene, as they are handled numerous times and placed in pockets in between uses, rather than disposed of immediately after use. After coughing, sneezing, or handling used tissues, it is important to do hand hygiene. Hand hygiene can be done by using soap and water, or with a waterless, alcohol-based hand rub. Alcohol-based hand rubs are convenient and are a good choice when your hands are not visibly soiled. Another important principle of respiratory hygiene and cough etiquette is social distancing. This involves keeping at least a 1 metre distance from other people if you are coughing and sneezing. This prevents droplets from being transmitted to other people nearby. Consider staying home and excluding yourself from work, school, and other public settings if you are unwell, as you may pass the infection on to susceptible people. Cough etiquette and respiratory hygiene are elements of standard precautions and involves coughing or sneezing into a tissue or into your inner elbow or arm. Hand hygiene after disposing of tissues is important. Social distancing and staying home if you are unwell are other important principles of respiratory hygiene and cough etiquette. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use this standardised infection prevention and control signs.